Welcome to this video. In this video, I would like to share about World Antimicrobial Awareness Week. WHO holds World Antimicrobial Awareness Week from November 18 to 24. This was initially called World Antibiotic Awareness Week and this was initiated in 2015. From 2020, it is called World Antimicrobial Awareness Week. Now let's see what it is about. The theme for World Antimicrobial Awareness Week is Handle Antimicrobials with Care. How did this era start? So, in the pre-antibiotic era, infectious disease was the major cause of death in mankind. The major breakthrough in healthcare sector came in 1928 when Alexander Fleming discovered the first antibiotic penicillin. This was discovered from the fungus. So, this led to the dawn of modern medical era. In World War II, penicillin was used to save lives of hundreds of thousands people. Following this, many antimicrobials were discovered. Antimicrobials represent antibiotics, antiviral, antifungus, and antiparasitics. Now the world is facing a global threat in the form of antimicrobial resistance. What is antimicrobial resistance? Bacteria, viruses, fungi, and parasites change over time and no longer respond to the medicines which they were initially responding to. So, because of this antimicrobial resistance, infections become increasingly difficult to treat or impossible to treat. So, what is the result of this? This increases the risk of disease spread, increases the severity of illness, as well as increases mortality. The magnitude of the problem is high because there is increasing antimicrobial resistance, but the clinical pipeline for antimicrobials is dry. Now let's see about antimicrobial resistance. There has been a global spread of superbugs. E. coli, which causes urinary tract infection, was initially responding to fluoroquinolones. Now these organisms are resistant to ciprofloxacin. 8.4% to 92.9% has been reported. Klebsiella pneumonia. It's one of the commonest agent causing bloodstream infection in ICU setup. This has been reported to be resistant to third generation cephalosporins. Anywhere around 4% to 79.4% has been reported. And these organisms are again resistant to carbapenem. More than 50% of these organisms are carbapenem resistant. Colistin is used as the last resort for these organisms, and in a few countries, even colistin resistance has been reported. Staphylococcus aureus, which are the commonest cause for skin and soft tissue infection. MRSA, that is methicillin resistant Staph aureus, has been reported. Mortality by these agents increases by 64%. Tuberculosis, which is one of the commonest condition which increases both morbidity as well as mortality in our country. Both rifampicin resistance as well as multi-drug resistant tuberculosis has been reported. So this increases the economic burden of the patient as well as the country. Not only antibiotics, antimicrobials, that are the drugs which are active against viruses, parasites as well as fungal agents, have also started developing resistance. HIV, NNRT resistance has been reported in more than 10% of the patients, and more than 50% of infants are suffering from resistant HIV. Malaria, which is caused by a parasite. The most common drug which is used is artemisinin combination therapy. In few countries, partial resistant to artemisinin as well as resistant to the partner drugs have been reported. Then coming to the antifungal drugs, Candida auris, which is one of the commonest fungal agent which causes invasive fungal infection. Resistance has developed to fluconazole, the cheaper drug, as well as the drug with lesser side effect. And oriconazole resistance and amphotericin resistance has also been reported. Now, do we have any newer antimicrobials to combat these resistant organisms? In 2019, 32 antibiotics are in clinical development, and of these, 6 are reported to be innovative. Apart from this, there is lack of access to quality antimicrobials as well as antibiotic shortage has been reported. So now, what are the causes for antimicrobial resistance? The first and foremost cause for antimicrobial resistance is misuse and overuse of antimicrobials. Antimicrobials are used not only in human beings but also in animals and plants. Misuse of antimicrobials as well as overuse is the main driver in development of drug resistant infections. Poor medical prescribing practices as well as patient adherence to treatment increases antimicrobial resistance. For example, antibiotics kill only bacteria. They cannot kill viral infections, which are the commonest cause for colds and flu, but they are prescribed for cold and flu. Antibiotics are also commonly used in farm animals and agriculture. The second cause for antimicrobial resistance is lack of access to clean water, sanitation, and hygiene. Lack of clean water and sanitation in healthcare facilities, farms, and community settings increases antimicrobial resistance. The most common cause of antimicrobial resistance occur in hospital setup. So when there is inadequate infection prevention and control, there is increase in emergence as well as spread of drug resistant infections. Now we are seeing COVID-19 pandemic. What is the influence of COVID-19 pandemic in antimicrobial resistance? COVID-19 is a viral agent. Antibiotics are not going to be effective against COVID-19. The misuse of antibiotic during this pandemic can accelerate the emergence and spread of antimicrobial resistance. COVID-19 is a virus, but many a times antibiotics are prescribed. So this should not be used unless bacterial infection is also present. How to combat this antimicrobial resistance? The WHO has put forward global action plan on antimicrobial resistance. So this formulates 5 objectives. Objective 1 aims at improving awareness and understanding of antimicrobial resistance through effective communication, education and training. The concept of antimicrobial resistance should be spread across the population. So this can be done by public education, also by including in the school curricula, and it should be a part of the professional training. Objective 2. So this is to strengthen the knowledge and evidence base through surveillance and research. The system should promote research activities in diagnostics, newer medicines, as well as the surveillance on the prevalence of resistant organisms, the mechanism of resistance, etc. Objective 3. So this aims at reducing the incidence of infection through effective sanitation, hygiene, and infection prevention measures. The resistant organisms are widely spread in the intensive care settings. So the spread of these organisms can be prevented by simple measures like hand hygiene. So every healthcare sector should focus on these measures to reduce the spread of these organisms. Objective 4. This optimizes the use of antimicrobial medicines not only in human as well as in animal health. So we'll be seeing in detail about how to optimize the use of antimicrobial medicine. Objective 5. So this aims at developing the economic case for sustainable investment in new medicines, diagnostic tools, vaccines and other interventions. Role of healthcare workers in antimicrobial resistance. So we can help by optimizing the use of antimicrobial medicines. This can be achieved by antimicrobial stewardship. What is antimicrobial stewardship? So this is defined as a set of coherent actions aimed at promoting responsible antimicrobial use. So this constitutes one of the 3 vertical pillars of every healthcare sectors, and it should be an integral part of every healthcare sector. It includes the following components: improving the diagnostic process, both clinical as well as microbiological diagnosis should be improved. Prescribing appropriately according to the treatment guidelines once there is a suspected or proven diagnosis. So whenever you see a patient who is suffering from infectious disease, either you suspect or it is proven, the appropriate treatment guidelines as per the hospital policy as well as the local organism should be implemented. Deploying strategies to promote responsible antimicrobial use. There are 9 areas where we can improve antibiotic prescribing. So these are overprescribing. For example, for viral illnesses, antibiotics are prescribed. This can be avoided. Common colds can be just treated symptomatically. Second one is overly broad spectrum. For example, for a pneumonia, where a third generation cephalosporin can be used, we presume that prescribing a broad spectrum antibiotic can improve the efficacy. That is not that way. Whenever possible, a narrow spectrum antibiotic can be used. Unnecessary combination therapy. So in a healthcare sector, when the patient is stable, where a single antibiotic can be used, we can avoid unnecessary combination therapy. Next is a wrong antibiotic choice. for an infection where some antibiotic may not be effective. Example in children, for pneumonia, cefixime is not the drug of choice, but if that is prescribed, it becomes wrong antibiotic choice. Wrong antibiotic dose. For example, for a resistant organism, a higher dose may be needed, but when we prescribe a lower dose, we are promoting resistance. Next is wrong dose interval. For example, for beta-lactam antibiotics, frequent dosing is required. Instead of giving a thrice daily dose, if we give twice daily, we are promoting resistance. Wrong route of antibiotics. Instead of intravenous, when we give oral therapy. For example, meningitis requires a IV therapy. Wrong duration of therapy. This is most common in surgical prophylaxis. It should be stopped within a period of 24 hours. The last one is delayed administration. The antibiotic should be administered as early as possible, especially in a critical care setting. The WHO has introduced a concept called AWARE. This classifies antibiotics into three groups. First is access group, second is watch group, and third is reserve group. Access group, this includes antibiotic or antibiotic classes that have action against wide range of commonly encountered organisms or common infections. So these antibiotics have a lesser potential for developing resistance. The next group is called the watch group. So these are antibiotics which are used for critically ill patients, and these are broad spectrum as well as they have a propensity for developing antibiotic resistance. The third group is called the reserve group. So this includes antibiotics which are reserved only for proven therapy for superbugs or multidrug resistant organisms. Any antimicrobial stewardship should have a control on utilization of both the watch group as well as the reserve group of antibiotics. Antimicrobial stewardship is closely related to infection prevention and control. In addition to the antimicrobial stewardship program, any healthcare sector should have an infection prevention and control program. So this aims at controlling as well as preventing the spread of multidrug resistant organism. The most common place where you encounter multidrug resistant organism is intensive care setting. You can implement hand hygiene as well as other infection prevention measures and prevent the spread of these superbugs. United to preserve antimicrobials. Thank you for patient listening.